Please stand if the following applies to you. Are you afflicted by mental illness? Do you personally know somebody who is afflicted by mental illness? Thank you. You may be seated. The World Health Organization found around 450 million people currently suffer from mental illness worldwide, but nearly 300 million never seek help. Now, sometimes statistics are hard to grasp. So if you look at this, you see the area in red is the amount of people who never seek help, ergo, never receive treatment. Now, a large reason for this is due to stigmas, improper education, and low funding from the government. Sadly, many cases of mental illness go undiagnosed or receive inadequate treatment. However, I believe this can be fixed if I can persuade you to adopt my 4 solutions to help yourself or to help others. My own sister struggles with depression and anxiety disorders. From knowing her and knowing others, I know that it's hard to accept that you have mental illness. She does not want to admit that she is sick. She says, "Oh, I'm fine. I talk to my friends," but we know she's not fine. She saw a therapist for a year and we saw improvement. She found out what caused her illnesses and how to deal with her emotions when she had them. Now, this is also a terrible cycle of ups and downs. She contributes to her lack of inappropriate treatment. Now, she will take her medication and she'll feel better, and then she'll stop taking it because she feels better. She says, "Oh, I don't have to take it anymore. I don't need it, I'm better." But this just means the medication is working. Now, some are like her, but others never receive treatment at all. To those afflicted, seek help and take your medications. Seeking help is the most important thing you can do for yourself. If you take anything from my speech today, I'd like you to remember the story I told of my sister. And know that mental illness is nothing to be ashamed of. You play a large contributor to the lack of appropriate treatment that you receive. The treatments are there to make you feel better, and if you do feel better, they're just working. As stated by bhevolution.org, once the mental health disorder is stabilized over a period of months, the medication should be continued for approximately 6 months. I believe a step will be taken in the right direction if I can persuade you to take the medication that you are prescribed and seek help. To those who know somebody with mental illness, provide unconditional support. Recognizing the problem and helping them find the help they need is very important. You have to be supportive of their decisions. We must help them, but the National Alliance on Mental Illness reminds them that we can't make their treatment decisions for them. From personal experience with my sister, as I've told you before, I just know that it's better when we provide support to her than trying to force her to take the medications, even though we know that she needs them. I'd also like to persuade you to go see your loved one's therapist. We did this with my sister, and her therapist told us how to deal with her emotions and how to help her. I think that if I can persuade you to visit their therapist, then you can help them with their treatment plans. Now to others. Get educated about mental illness and do not discriminate. The World Health Organization says that stigma, discrimination, and neglect prevent care and treatment from reaching people with mental disorders. Telling people with anxiety to calm down or telling people with depression to cheer up is not going to help them. It's not beneficial to them at all. They are just as ill as somebody with a physical handicap. And I would persuade you to become educated, and you can do this by reading. Many sites like the World Health Organization, as I've mentioned before, have interesting and very accurate facts about things like depression, anxiety, and schizophrenia, which is very prevalent here today. Also, many college campuses offer classes. I personally learned a lot about mental illness in my psychology class my freshman year of college. Now to the governments. More money needs to be spent on mental illness. Currently, more than 40% of countries have no mental health policy. Many people are unable to get the treatment that they need due to low government funding going towards this. Also, a very large percent of homeless people have mental disorders of some sort. They're victim to stigmas and they have a very poor quality of life. The Mental Illness Policy Organization states, a recent study has found that 28% of homeless people with previous psychiatric hospitalizations obtained some food from garbage cans, and 8% used garbage cans as a primary food source. Along with the homeless, prison inmates suffer from untreated mental illnesses, and a lot of violence is due to these untreated mental illnesses. But I believe if more money goes to these things, then more people can receive the treatment that they need. Now, there's also a very low amount of mental health providers. In Alabama, for example, 1 in 1,260 people, there's one mental health provider. Unfortunately, there's a very large percentage of mentally ill that go without appropriate treatment. However, I believe that if you can adopt some of my solutions, then this will be solved. I believe everybody here can adopt at least 2. I know they were specifically set for specific groups of people, but I feel like everybody, if you're afflicted, then you can become educated and get help. If you know somebody afflicted, you can become educated and seek help for those you know. Again, I ask for your participation. Do you know you can take a stand and make a difference in the lives of the mentally ill by helping them receive the appropriate treatment they deserve? Please stand if so. Thank you for your participation and thank you for your time.